What medical records or documentation help prove my injuries and pregnancy-related concerns were caused by the crash? The most helpful proof is usually a clear medical timeline that starts right after the crash and continues through follow-up care. Emergency room records are key because they document what you reported, what the provider found on exam, what testing or monitoring was done, and the assessment and plan, especially any pregnancy-related monitoring notes if you were checked for fetal well-being. After that, obstetric and prenatal records from visits close in time to the crash can help show new symptoms, restrictions, and concerns discussed after the collision. If you later developed pain, like hip pain, the first orthopedic visit note matters a lot because it typically records when the symptoms started, what you told the doctor about the crash, the exam findings, and whether the provider discussed trauma versus other causes. If there was a gap in treatment, insurers often argue the symptoms were not crash-related or were only pregnancy-related. So records that explain why care paused and when symptoms returned can reduce that argument. Also try to keep copies of imaging or lab orders and reports, even if results were normal, because they show what symptoms prompted evaluation. Finally, make sure the history in your records is accurate about how the crash happened and when symptoms began, because inconsistencies are commonly used to dispute causation.